Hi, my name is Shauna Ryle. I'm a women's health physiotherapist here in Cork University Maternity Hospital, and I'm here to talk to you today about your posture and your back after having a baby. So posture is how we hold our bodies in position. Pregnancy challenges what we do, so it's very important to be aware of little changes that we can make when we're having our babies. So typical posture is head, ribs, pelvis, feet, all in alignment with nice equal weight down through both feet. Pregnancy changes this because we've got to give a space for the baby between the rib cage and the pelvis, and we can do this in a few different ways. So I'm going to turn my body to the side so you can see what I'm speaking about. So as I said, head, ribs, pelvis, feet, equal weight down through both feet. With pregnancy, we've got to make space for the baby between the rib cage and the pelvis. We do this in a few different ways. We're all different shapes and sizes. So things to look out for. Has your rib cage popped up? Have you increased the curve in your back? Or have you moved your body weight backwards? All of these three different ways of increasing the space between rib cage and pelvis are present after pregnancy. So have a look at yourself and see which one you do. So staying in this post-pregnancy posture really doesn't serve us anymore. The tummy muscles are lengthened and these can stay unstretched. We're not using everything that's available to us. So our bottom muscles, again, aren't fully kicking in like they should do. And this in turn can put extra pressure down on the pelvic floor. So ways and means of getting yourself out of this posture, think about bringing your body weight back forward again. So some little cues to think about. So a nice easy one is think about bringing that rib cage down and forward. Again, similarly, imagine that you're trying to push your hips back, okay? And again, think about having nice equal weight through both feet. So if you're looking at yourself side on in a mirror, again, think, is my head over my rib cage? Is my rib cage over my pelvis? And do I have equal weight down through both feet? So I have here my little baby. If you imagine that a newborn can be anything from 6 pounds, 8 pounds, 3 kilos to 4 kg, you're lifting quite a weight, quite a bit. Very important that when you have your baby in your arms, that you do hold your baby and use your posture well. So this holding baby centrally in close to you is a very good thing for your back. A position that we wouldn't recommend, but which I see an awful lot of new mums doing, is holding their baby, but again, going back to that pregnancy posture. Okay, so you can be here, holding, winding baby, and again, big curve in back, loads of back pressure. So while baby is up in arms, a nice little cue to think about is bringing body weight forward, pushing the hips back, untucking the bum, up nice and tall. So a very frequent thing that we do with a baby is changing nappy. So I have my baby here on a surface that's quite low. If I'm doing this repetitively, I'm down here for quite a while. I'm cleaning, I'm wiping, I'm changing. As you straighten back up again, you will be aware of your back. The more you do it, the sorer and the more tired it can get. So change that, think about what you can do instead, and try to operate more so at waist height. So I'm just going to bring my baby up here now again to waist height. You can stay here for ages, not a problem, no strain on the back. If you don't have a changing unit, feel free to kneel down beside a surface or sitting on the floor. So I have a kettlebell here with you. I've brought a kettlebell in today to show you something that I see quite frequently. We carry our babies in their car seats a lot, and typically what I see is a new parent with their baby in the car seat, and they've gone into this position and are trying to walk with a baby in this position. This isn't good for your back. You're lengthening this side, you're shortening this side. A better way to do things is to keep the pelvis level. Okay, you can still hold the car seat out to the side a little bit, but just don't give in to the weight of it. So try to keep the pelvis nice and level across the front. Another alternative that you have is to hold the car seat in quite close to your tummy, or again, really, if you can, do bring the base and the wheels of the car seat with you, and then you can push.